So our next and final speaker is Manvi Bhalla. Manvi is going to speak on how community-based environmental justice work can advance health equity. And Manvi has quite the resume, so I'm going to read this so I don't want to miss it out. Manvi is an activist scholar with over 15 years of community organizing experience. She is one of Canada's top 25 under 25 environmentalists, top 30 under 30 sustainability leaders, and is the Youth Eco Hero of the Year award has gotten the Youth Eco Hero of the Year award. I get it. In 2022. She co-founded Shake Up the Establishment, a national nonprofit dedicated to climate justice and political advocacy. She has created Misinformed, a nonprofit focused on health promotion for women and gender diverse people. She's also a public scholar of this cohort and a health equity stream scholar. And now she's going to tell us about her work. Manvi.
Hi, it is bright. Awesome. Cool. Hi, everyone. I'll just go like this. So I'm just going to preface, I have a very hard time with time constraints. I will do my very best, and I can always expand on some of the stories in other situations as well. So I apologize if I talk a little fast. It's not just a time constraint, it's also the ADHD, but I hope to keep it interesting for you all. Awesome. So today I'm going to be sharing a glimpse into a novel theoretical framework that I developed as part of my PhD research, and briefly my experience in applying it to a Canadian environmental health policy context, both through my community-based organizing work and my research. So firstly, I want to situate myself in the context of the work I'm going to share today. This is important as a practice, not only because I'm a researcher, but I think honestly more importantly from the community organizing work that I do. I'm a neurodiverse Punjabi Sikh woman who immigrated to Toronto, Ontario at age 3, and I've called what is currently Canada home my entire life. In 2021, I moved to the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh to start my PhD here. And my formal education training, although I do a lot of environmental stuff these days, is actually in health. And my undergrad was in biomedical science, my master's in public health and health systems, and health policy. And I'm not going to go into repeating the wonderful introduction, but as it was mentioned, I do have two national nonprofits. I'm going to be sharing a little bit about the work that we're doing at Shake Up the Establishment, which is the one focused on environment and climate justice. And I just want to mention, kind of to value orient myself, I understand the environmental degradation and the climate crisis to be public health crises. And so I use an intersectional justice lens to address these issues in an equity-centered manner. So I'm going to start off by first telling a little bit of a story, and I'm going to try to do that throughout my slides, but we'll get into some of the technical stuff as well along the way. In Canada, we have an environmental racism problem. The photo displayed here is of a Freakville, a predominantly Black town in Nova Scotia, where the city of Halifax collected taxes from residents, but did not provide basic utilities, infrastructures such as paved roads, sanitary water, sewage, public transport, garbage collection, recreational facilities, fire protection, street lights, and sufficient police protection. In 1912, the city of Halifax decided Freakville was to be used for industrial development through no appropriate consultation with the residents. And by 1947, they had rezoned it for this purpose. Again, no consultation. In 1950, the city built an open pit dump there, and in 1965, the city ran an urban renewal campaign in which they bulldozed homes and forcibly displaced residents, with some moving into public housing. The whole area was replaced by environmentally hazardous industrial developments such as fertilizer plants, slaughterhouse, tar factory, stone and coal crushing plant, cotton factory, prisons, 2 infectious disease hospitals, and 3 railway track systems. Despite numerous attempts at launching class action lawsuits by former residents, no individual remuneration or reparations have been provided to this community. They've in fact been denied many attempts at class action lawsuits. And unfortunately, this kind of injustice is not just something of the past. Studies from my colleague, Dr. Ingrid Waldron, who's one of the leading researchers for environmental racism in Canada, have found that even today in Nova Scotia, there is state-sanctioned patterning of toxic facilities, waste disposal, and pulp and paper sites being consistently placed closer to Indigenous and Black communities. And so to understand why this is the case, we must first understand that Canada is an ongoing settler colonial project, where settlers' aspirations are to transform Indigenous homelands into settler homelands, and to create moralizing narratives about why it is, or was, necessary to do so. Central to this process is profit-seeking, through land acquisition, resource extraction, and alongside being denial of being responsible to or upholding the rights of Indigenous governance systems. Now, I'm going to expand this a bit and kind of explain that European colonization was not only a means to secure wealth through imperialism or expansion, but colonial relations imposed a right way to live life upon all whom they colonized, or rather, a white way. This created the conditions for non-white people to become racialized, which became synonymous with uncivilized, and socially constructed white spaces as pure, innocent, untainted, orderly, empty, unoccupied, and free of racial other, as my colleague Dr. Ingrid Waldron explains, as compared to racialized spaces of material depravity. Cycles of possessive investment into whiteness maintain these racialized hierarchies and help to explain why the siting of landfills and the zoning for industry favors the white elite and justifies the prioritization of industrial profits at the cost of the lives of Indigenous, Black, and other racially and ethnically minoritized communities. And I want to go one step further and bring in one more system. Under the normative conditions of the capitalist patriarchy, women continue to be disproportionately exposed to more environmental hazards, and yet are understudied, underheard, underrecognized as being differentially and cumulatively impacted, particularly during critical windows of vulnerability, such as puberty, pregnancy, menopause, and they are also undervalued under capitalism. For example, gender roles contribute to the feminization of jobs such as cleaning, which means that these jobs not only pay less, if they even pay at all, but they involve a higher cumulative exposure to toxins and chemicals. And of course, given the structural determinants of health, further health inequities exist for racially and ethnically minoritized women, and even to a greater degree, gender diverse and two-spirit peoples. So overall, the settler colonialism, white supremacy, and the capitalist patriarchy are interlocking systems of oppression, which are critically impacting health outcomes for marginalized and minoritized populations in Canada. And in many ways, these systems synergistically work to privilege some to the detriment of others, and they cumulatively determine who benefits and who pays the price of the continued release of carcinogenic, neurotoxic, endocrine-disrupting chemicals, all of which is tied to capital land use, colonization, race, and the state. And so bringing this together, I developed the Intersectional Anti-Colonial Environmental Health Justice Framework. And under this framework, environmental health inequities can be seen as a product of systems of oppression which manufacture precarity and force vulnerabilization upon systemically underprivileged individuals and groups. And we can begin to address these issues through the 5 dimensions of justice, which I'll quickly outline to the best of my ability. And so I'll take you through it in a little bit of an explanation type manner, but if you want good definitions, please feel free to follow up with me. So often environmental injustice begins with the identification that a group is being subject to distributional injustice, meaning that they have a disproportionately higher exposure to environmental hazards and lesser access to environmental benefits. And so a devastating example of this can be found in the experiences of the Omjawaan First Nation, as pictured here, who continues to be disproportionately exposed to industrial pollutants in what is currently called Chemical Valley in Sarnia, Ontario, and has been extensively documented to be experiencing intergenerational harms as a result. Consequently, we have identified that the communities have disproportionate exposure. Okay, so what's next? So we kind of consider, are these affected communities able to engage in decision-making processes that inform solutions for this issue? If that's not the case, and if these processes are exclusionary, then we address those barriers by mandating community representation as part of advancing procedural justice. But what if the community members are now present in decision-making, albeit in small number, and while they're contributing to discussions, their recommendations are not being truly heard because it's not informed by Western scientific evidence? So epistemic justice works to not only advocate for the inclusion of diverse knowledges, but it also asks us to challenge normative assumptions of what an expert looks like, speaks like, acts like, and so that kind of translates to our example to think, okay, so there's a few community leaders participating in these consultations, but say that the government wants more people and it wants to have more public consultations, but there's no interest from community members. Recognition justice works to recognize the dignity, agency, and rights of minoritized groups, but also acknowledges their unique historical contexts. And so as part of this, recognition justice would mean that the government factors into their analysis that maybe it's not that the community is apathetic, but rather that they don't trust the process of participating in this for fear of tokenization or because of persistent underservice, or probably both. And this means that, factoring in and advancing, obviously, reconciliation for Indigenous peoples, but doing so in an actually meaningful manner. And lastly, recognizing that health is beyond just the physical dimension and knowing that community health outcomes are shaped by a plethora of factors. Healing justice works to recognize the interconnectedness of all this and works to ensure that if we want, for example, Indigenous youth to engage in decision-making processes for years to come, that they have access to their ancestral lands and to elders who can teach them knowledges and languages. And this ensures that not only are these people included, that their knowledge and perspectives are meaningfully informing decision-making, but that there's we're advancing reconciliation, but that we're also working to ensure cultural and epistemic continuance for these communities, that colonization and settler colonialism in particular continue to strip. And all this coming together, what the purpose of these 5 different dimensions is to go beyond just recognizing and documenting harm towards actually helping communities thrive intergenerationally, not just survive. And so, on that somewhat bleak note, I want to end off the presentation on a high note and share a very brief story about some inspirational work that's happening to help actually advance environmental justice beyond the theoretical frame that I just shared. And so, what can we do about all this? As was mentioned, I'm the executive director and co-founder of a national youth-led group, Shake Up the Establishment. We're a largely volunteer-run organization that advocates for intersectional, anti-colonial environmental justice and climate justice through nonpartisan, community-centered, and evidence-informed advocacy. And so I'll kind of jump back and forth for a second because I have to provide you with the context of what we engaged in. But there is 2 really significant opportunities to advance environmental justice in Canada right now. The first is a result of the 2023 updates to the Canadian Environmental Protection Act, which, believe it or not, for the first time, recognize that we all have the right to a healthy environment. And I think that's something that I always kind of chuckle at because I think, isn't that something that we should be born with? But it was only a federal law as of 2 years ago, or last year. And so now the government has held a 2-stage consultation process developing a framework that can outline how they can actually uphold this right for populations across Canada. And given everything that I've shared, it's pretty easy to see it's going to be easier to do for some groups compared to others given the structural determinants of health. The second really important case right now, a really important action that we can take, is that as of June of this year, there's a bill that received royal assent, which kickstarted a process to develop, for the first time in Canada, a national strategy to address environmental racism and advance environmental justice. Both of these have incredible potential to advance health equity quite rapidly because they are happening at the federal level, and one of the biggest things the federal government can do is put more money into things like collecting race-based data, things like providing communities that are affected by environmental racism and who are experiencing intergenerational environmental harms with remediation and money to, fix the health issues at the source and do so intergenerationally, or at least we hope. And so I want to end by kind of sharing with you that little example, as I was saying. Earlier this year, my team at Shake Up the Establishment submitted a 53-page policy brief, single-spaced, kind of just threw it at the government and said, we have a lot to say. And you know what? We were told they're not going to read it, blah, blah, blah. It's out of scope, all that stuff. You're a little angry, They read it cover to cover, and they were like, hey, this is the best one we received. It taught us a lot, so can we give you money to do more of this for the last stage of the consultation? So that's kind of what we're doing right now, which is very exciting. I just got back from the Calgary event last night. It was the first event of a bunch lunch that we're hosting across the country, which is really exciting, in collaboration with 2 other national youth groups. There's nobody over 30 working on this, and that's not to be disclusionary, but it's to say young people do care. I get that a lot. We do. We're here. And we are engaging young people across the country in helping to provide feedback at this final stage of the consultation process to design how the government is actually going to uphold our right to a healthy environment. And one of the biggest pieces that there's a new principle as part of all this that they're calling intergenerational equity. And so finally, they're really beginning to consider, I should say lightly, the impacts of our current actions today upon generations to come. And I think it's really exciting that young people are being a part of this conversation, because really, not only are we inheriting this world, we're currently living in it, and it's kind of scary. So I just want to end off by talking actually in like the shortest sense of all the things I've mentioned about my PhD research, because LOL, that's actually why I'm here. So I am a health equity scholar. I'm in the cohort this year, and I'm very grateful. And the study that's actually been funded through this stream is doing community-based workshops, participatory action workshops, to get the perspectives and knowledges of newcomers and immigrants, and particularly South Asian, and in further particularly women and girls, because these groups are not really being considered in any capacity when it comes to these conversations, but are experiencing disproportionate exposure to environmental toxins, chemicals, pollutants, waste, all these things, not only in their homes, but at their work, in their neighborhoods. And there's a lot of different systemic factors that are disadvantaging these groups and having a lot of intergenerational harm to their health. So I'm very excited to be able to do community engaged work with my community in Toronto and Vancouver and the surrounding areas. And I also want to say there's a couple of other studies that I'm doing as part of this, so I'm very happy to talk about it. I think it's every researcher's dream to get asked questions about what they're excited about, so I'm here. And yeah, I just want to end off with leaving you with some QR codes, as one does. So here are some ways you can support. In addition to the events that we're hosting across the country, of which Vancouver is actually coming up in not this Sunday, but the following Sunday. People can also engage in the survey if they can't attend one of our events, and they're able to share their opinions. And we will be writing up all of the contributions from community members across the country and giving it to the federal government to inform our right to a healthy environment. So thank you so much for your time.